Hello to all my people and friends. In this day, we'll have an important interview about medicine, about technology too. It's amazing how these two can connect. So, in this occasion, we have Dr. Robert Cucin. How are you, Doctor?
Great, very good, Oswaldo. Thank you for having me on the show.
Yeah. One question is, who is Robert Cucin?
He's a board certified general and plastic surgeon who's affiliated with Cornell in New York, and he's the chairman of the board and the CEO of Biosculpture Technology, a medical device company.
Okay. Last week, I see an interview that you were an engineer, right? Something like that.
Well, actually, I would have been an engineer, but I wound up being a plastic surgeon because when I was a child, I met uh, a boy with a congenital defect and wanted to become a pacemaker and help people like him. But I always had an engineering bent, and that's why I eventually wound up designing instruments that I used in surgery for myself.
Okay. Can you tell us more about biosculpture?
Sure. The company was founded in 2001. It was originally a liposuction company because I had a bunch of patents. The first one I licensed out, it wound up with Ethicon. It created the power assisted liposuction market, which grew to be 500 million a year. And I took the more advanced patent designs and made the airbrush liposculptor 2, which was the one that we launched the company with. It's a tube within a tube. Everybody has seen liposuction on on the internet or on some TV show, and it looks barbaric. You take a rod with a attach it to a vacuum, and you shove it back and forth underneath the skin. It's pretty barbaric. So what I had done is taken that tube, put it inside a sheath, aligned the hole that sucks the fat with a slot, and then you could advance it mechanically very rapidly, and you don't have all of that tissue trauma from the advancing tip of the inner cannula because the sheath is protecting the tissue, and the surgeon doesn't have to be a laborer with a drudgery. It unleashes the artist and the surgeon, and you can have very precision liposuction. Now, what's exciting now is that we can take that same instrument and adapt it into a pistol, put it through a trocar, which is the little funnel type thing that you make these tiny little incisions in the abdomen to do laparoscopic surgery that you can just cover the access points with a band-aid. And we can actually remove the fat that's inside the abdomen that causes type 2 diabetes. It's the visceral or belly fat underneath the muscle inside the abdomen that causes type 2 diabetes because it secretes resistin, which antagonizes insulin. If you take it out, it's like treating a thyroid, removing a thyroid for somebody who's hyperthyroid. The disease is ameliorated. It's very much improved. If somebody is not very obese, it should be treated. It should treat their type 2 diabetes. If somebody's morbidly obese, you might have to repeat it. But up until now, we could only cut the fat out, and we could only cut the fat from the omentum, which is not as metabolically active as the mesenteric fat that we can now remove. And that's why it's so darn exciting, because we have the potential of doing for obesity and type 2 diabetes the same thing that LASIK did for vision correction. We can, do it in an outpatient procedure, hour and a half. Patient will get off the weight. We will have treated their belly or their muffin top, and then over the next 6 to 9 months, they'll lose anywhere between 3 and 7 times the small 8 to 10 pounds we've taken out in terms of body fat, and they'll have a better metabolic profile. Their hypertension will go away. The diabetes will go away. Sleep apnea will be less, and gastric reflux will be less. All of those things that come because of that visceral or belly fat. Pretty exciting.
Wow, yeah, pretty exciting. Another of the question is, biosculpture is only in United States, right?
Well, we still, the company is located in the United States, but we export, and we've already launched in Asia through Umeco. which is one of the largest Asian distributors. Been to South Korea a bunch of times.
Yeah.
We'll be using Sirtec Med to manufacture our instruments. They do a lot of the work for J&J, Ethicon, and Medtronics, and they're CE certed, so we'll be able to launch in Europe with a CE mark very easily and quickly.
Okay, really amazing. So one question is, why do you think about this culture? One thing, because I think it can be because you want to help more people, right?
Yeah, entirely. I mean, as a doctor, I can only reach, I can maybe do 300 to 400 operations a year. Through this, we literally can help the 2.1 billion obese people about the globe. Just in the United States, there are 20 million diagnosed type 2 diabetics. Uh, if we can just treat, change their lives, I mean, it's very expensive for all the country's health care, for all of the insurance companies. A typical diabetic's $9,800 a year. Diabetes is the most frequent cause of kidney failure requiring dialysis, very frequent cause of blindness, and the cause of half of the non-traumatic amputations. It doesn't just shorten somebody's life, it makes what life you have very much less pleasant. It reduces the quality of that life.
Okay. The last question is, what's biosculpture having the future for us? Is it kind of secret, something like that, in the next 3 years, something like that?
Well, no. From right now, we're in the process of getting funded so we can launch. We have switched our production from pneumatic to electromagnetic. The United States launches its planes off the carriers with an electromagnetic launch system. Took them billions of dollars to develop it. We use this for our instruments, but it only cost us 1.3 million to develop. And so we're changing our production from gas to electric because that's basically what the world wants and all the younger surgeons like. And as soon as we're retooled, we'll be in production by the end of the year. So we should be in clinical testing within a year, which is very fast.
Okay. So thank you for this short interview. We'll know more about biosculpture, and maybe in the future we'll get you soon to see what else you have, you know. And
I'll be pleased to appear again.
okay, so thank you. See you
Thank you
another
very much.
time.
Thank you very much for having me.